Hello, welcome back to another episode of Ask the Doctor with Dr. Jeffrey Sherman. Hello, Dr. Sherman. Nice to see you again.
Hi, good to be with you. Thank you.
Yes, happy holidays
Thank you.
and happy New
Happy New
Year.
Year. Very nice.
So today we have an important show about really breaking down the fundamentals of vaccines and why you should really encourage your social group to get the vaccine. The vaccines significantly reduce the amount of infections that are possible from this disease and will help us eliminate the pandemic faster and then reopen quicker. The COVID statistics for January the 7th, 2021 are as follows. There are 21.4 million cases of COVID-19 in the United States and 361,000 deaths from COVID-19. Yes, very large numbers. Those could have mostly been preventable, like other countries have, if different steps were taken earlier in the pandemic. But we have to deal with what we have right now and try to prevent more from happening in the near future. And also keep in mind that those are just confirmed cases of COVID-19. There's very likely more than 21.4 million cases in the United States. So we're back. Nice winter break. Was able to really relax, and now we're back at full force. And what better way to start off our vaccine talk than to bring up how Dr. Sherman, didn't you get a vaccine?
Yes, I was able to get the first of the two, shots, if you will. It's a two-step process. I got my first one about 2 weeks ago, a little more than 2 weeks ago, and then it's a 21 days in between the two shots. I received it in the upper right arm muscle, the deltoid muscle. No problem at all. Made my appointment through my hospital and got the first shot. Did not feel any side effects immediately or subsequently. Had a little bit of a sore arm for a day and a half, and then that went away. They held me in the vaccine area for about 15, 20 minutes after my shot to make sure I didn't have any acute allergic reactions.
Okay.
And I did not, and it's very rare. That's another thing. It's very rare to have an allergic reaction.
Exactly.
So I went out and no problem. And then next Wednesday, which would be 21 days after my first shot, I get my second. They say that the second shot patients or folks are a little more likely to get some sort of reaction or side effect. We'll see. The folks I've talked to really haven't gotten much in the way of side effects. A colleague of mine in my office did feel a little chills, may have run 100-degree 99 fever or so for about 6 hours, but a dose of Tylenol and a little sleep overnight helped that out, and so he was fine ever since. And that's basically all there is to it. Everybody was clamoring to get their vaccines. The folks around the hospital are very in favor of this. Everybody should be in favor of this. And it's a way to stop the spread and basically stop the sicknesses from happening. The hospitals are quite overwhelmed.
Exactly. I mean, healthcare workers are frankly in hell right now, especially in the emergency room, and I mean, really in general. And these vaccines are a godsend for them because it means that they can be more relaxed about themselves and be able to put more concern into all the other people that are frankly dying of this disease.
I mean, it protects the healthcare worker, and there have been several that I know of who have gotten it. So it protects the healthcare worker during the onslaught of cases that we're going through right now. And it'll eventually curb, it'll make it so I mean, there's still going to be some cases, but it'll make it so they're sporadic and certainly not of the volume or of the strain on the medical system that it is right now, which is, they're rationing or not. There's a shortage of oxygen in emergency vehicles, like you call the paramedics, and and oxygen's not exactly easy to get. Same, and in the hospitals, the same thing. So things like we never thought would be an issue are
Right.
becoming issues.
Exactly. I mean, we like to, or not we necessarily, but people like to portray America as being like one of the richest countries in the world. But this pandemic has brought it to its knees,
Yeah,
especially in the medical system. I mean, a lack of resources. I mean, our country has a lot of resources, but this pandemic has truly been crushing. Uh, and that's another thing, like you mentioned, where the paramedics are just, they have too much activity going on. There's not enough oxygen, like you said,
yeah,
and it's just, if just try not to put yourself in a situation where you would have to need to go to the ER. Obviously, these things are accidents. That's why they're emergency like. But if for whatever reason you or someone you know was going to engage in a slightly risky behavior, then try to stop them.
yeah.
Um, exactly, because you don't want to go there, and medical workers also just have enough to deal with already, and these COVID cases. I do want to ask for clarification about, to kind of describe to people, what does it really mean when uh, they say the ICU is at near capacity? Like, what does that mean, I guess, in the hospital setting?
Well, I mean, a hospital is an enclosed building, and there's a finite amount of beds in the building, and there's a finite amount of ICU beds. ICU is a special area of the hospital where there's special equipment for the critically ill patients that can only be used in that area. They got special made up rooms for special equipment, and of course, you need nursing staff and and respiratory therapists to help monitor the patients. And it's a one-to-one these days, one-to-one nursing, or 1-to-2, one nurse for every two patients at the most, as opposed to on the regular floor, one nurse to every 5 to 6 patients. But in the ICU, it's a special room, and there's just so many of these rooms available now. Cedars has converted some more areas to ICU type rooms, but there's still they can't do they can't convert every place to an ICU type of room, and they have also converted many of the holding floors. What I mean by that is like pre-op, like if you're going in for a gallbladder surgery, or if you're going in for a vascular
Uh,
surgery, or kind of hanging out in a pre-op area in a room with an IV pole and some monitors. Well, those areas are now hospital beds for inpatients with with either COVID or anything. There's just the overflow of the patients because the COVID patients are taking. There's just such an influx of them. There's still other patients in the hospital too, and so they just need more regular beds too. And they're converting these pre-op and post-op and holding areas as hospital floors, as opposed to just the general rooms, which of course are filled to capacity. So you've got
that's
an
right.
overflow of regular rooms, and they've converted a few extra ICU areas to more ICU beds. I remember when I was a resident there, there was the medical intensive care unit, the respiratory intensive care unit, the cardiac intensive care unit. Those were the medical ICUs. There's the surgical ICUs and the heart surgery ICUs. I think those are still for those patients. But the MICU, the RICU, and the CCU are filled to capacity, probably with not only the pneumonias but the COVIDs and the heart attacks and everything. And the patients who are desaturating on the floor have to hang on until there's an
Yeah,
ICU bed available.
that's right. I really want to reiterate, this is just the ICU. This isn't the regular emergency room for those patients. The ICU is for what you said, critical condition patients, which, what's the barometer for critical condition?
It's basically, it's it's you got to look at the patient and see what they're, if they're breathing, their breathing rate. You take the saturation on the pulse ox. I have one here. Maybe I can show you.
Yeah, sure.
There's a little. This is a pulse oximeter. It's a little device that you put on your finger.
Oh yeah, those things.
You've seen these. It'll tell you my heartbeat. You see it beating. And in a minute, it's going to give you my pulse and my oxygenation number. The number on the right is going to be my pulse once it gets up here. The number on the left is going to be my oxygenation. The oxygenation is the number that patients on the floor that they're looking at.
Right.
It's 100%. It'll get here. I'm hopeful. I got cold hands, maybe.
Yeah.
But you want to be 95, 98%. That means how much oxygen you're carrying in your blood compared to how much you can take. It'll come. I got a good waveform there. It should be registering. There we go. Hold on.
Is your hand supposed to be flat?
40 doesn't look so good. You
No.
want to be 90. Hold on. What's going on?
I think your hand has to be flat, right? Resting on something.
Let me just
kind of hard to show it to the camera
for a second. Let me put it to my right hand. Maybe that's the difference. I don't know. Anyway, my point is they check this for everybody.
Right. The vital signs.
And if you're below 90, if you're below 85 even, they're going to want to move you to the ICU. What they can also do is get a blood gas, a blood test to tell how much oxygen is in your blood, an arterial blood gas. And that is saying what that's a measure of how well you're breathing too. And those critically bad results are moved to the ICU.
Exactly. These there's no overemphasis. There's no way to overdo emphasizing the suffering that happens to patients that have to be in an ICU, the intensive care unit. It's where, we're just describing the raw medical barometer for patients going to the ICU, but that's kind of what's also good to emphasize is how it feels to be someone that needs to be in the ICU. Is there a single ventilator for each ICU room?
I think so. There probably is. Yeah.
Okay.
They're not all in use at the same time, and there's probably more than that in the hospital's overall supply.
Right.
But every ICU room, you got to plan on. There's got to be a ventilator available for that patient on the ready at any given time.
That's right.
And because that patient, whether they're in there for a pulmonary respiratory illness or not, they still may need that ventilator.
Right. And ventilators, of course, your pulse.
96. So that's okay. If that gets below 90 or 85, and some patients it gets into the 70s, that's a problem in terms of your oxygenation, and you head to the ICU. Your lips will start to turn blue. Patients are just,
yes.
And that's not on room air either. They're on an oxygen mask, so you're going to see them struggling.
That's right, struggling to breathe.
Right.
Something that we do constantly throughout our entire lives is now a 100% effort for these people because of COVID-19. This is why we need to have been and still wear masks and social distance and do all the things that doctors have told us to do ever since the beginning. And now there's a new thing that we can do, which is get the vaccine.
Right.
And this will seal the deal, put the nail in the coffin for COVID-19.
Yeah. It'll make it so that the virus doesn't have anywhere to go. The more people who get the vaccine, it's like the door is closed for that virus to go there. Right now, the door's open in a lot of people. The virus is jumping from the patient A to patient B and C, and then patient B and C go to patient C, D, E, F, and G. Boom, 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 and before you know it, one has given it to two, who's given it to five, and now you've got 8 people have it in 5 minutes.
Exactly, and always remember
the vaccine, A, B and C can't get it, so it's stuck with A. So therefore, C, D, E, and F can't get it either, and just A's
Right.
got it. And then A recovers, and then everybody gets better.
Exactly. It's a very complicated web for
Yeah.
the connections between spreading. And always remember that COVID-19 will spread without a person needing to show symptoms for it. This is also why you have to always be wearing a mask, because you never know when you could
Virus
have
is
that.
almost like the perfect virus. They figured out a way to
Yeah.
spread it like under the radar, and so we just have no idea.
Mm-hmm. It's an invisible virus, as I like to call it.
Yeah.
Now, we do have a question from the chat. How did the hospital handle the vaccine appointments?
Excellent question. They sent out a questionnaire on your hospital email. The hospital doctors, the nurses, and everyone's got their own hospital email. So they sent you a questionnaire with questions such as, can you work from home? Do you work within 6 feet of patients? Do you work in the ER? Do you work on the floors? Do you work with droplets in the mouth, or in my case I do with endoscopies, or do you work with
Right.
secretions such as stool, which I do? So I answered yes to most of them. There was a couple that didn't apply to me. Anyway, everybody answered the same questions, and they stratified that. Then the administration or the vaccine people, whoever, sent you an email with a link that says, okay, now you can make your appointment. And you make your appointment through your hospital account, and so the top priority folks based on that questionnaire were sent that email on day one, and then the next priority folks were sent the email on day two, and then the appointments were filled accordingly. And then you click on make an appointment, and you pick an appointment time, and it was all online through the hospital email system, and you went ahead and went on your appointment day. It was the honor system. Of course, they have a list of the appointments for the day there, and you gave them your name. They check you off. You go in. There's about 20 desks or 20 stations that had all the vaccine givers, and boom, you get a shot. But it was all done through the hospital in some kind of emailing questionnaire system. There was probably some IT genius back there kind of formulating the website as we went along.
Right. We also have a concern with somebody in the chat. If a person has allergies, should they still get the vaccine? And I think you actually mentioned a bit about this when you were getting it.
Yeah, I think so. I know the folks who are more likely to have a reaction to the vaccine are those who have reactions and things to, in general, peanuts, shellfish, iodine.
Reactive immune systems.
Yeah, so I would have the vaccine at the ready. I might even take some. I would get the vaccine. I would maybe take a little pre-vaccine Benadryl, a pre-vaccine, pulse steroid, and then get the vaccine, and then be observed for an extra bit of time. Maybe stay there for about a half an hour, 45 minutes, and then still have your EpiPen ready and some Benadryl. But I think that's the way to go. The allergic reaction is going to happen within the first half an hour. But still carry your tools around with you at all times. But the allergic reaction is going to happen quite early, and if it doesn't happen within the first half hour, it's probably not going to happen. But I would still I would not let your history of allergies dissuade you from getting the vaccine.
That's right.
A case of COVID and the potential longer-term sequelae of that will have much more of an effect on a patient than a little bit of an allergic reaction that can be reversed.
Exactly. And like you displayed recently, how it's not just protecting yourself, but it's protecting other people that you interact with.
Yeah, at this point, it's not studied. We know, though, that in vaccinated patients, the viral load is low. Whatever virus they may have, they may not have it at all because they've got the vaccine. But if they do have it at all, it's slight and it's a little bit. They don't know if they can. We don't know if you can transmit that or not. But even if you could, it's still such a slight little bit. You would think it wouldn't be a big risk. But they haven't studied it, so we don't know for sure. So I can't say, since you've been vaccinated, then you can go over to your grandma's house and give her a hug. I still would say, don't do that. Let's wait and
Right.
see if we get more data. You're less likely to give it to her. You yourself won't get it on your way over there or in the supermarket, but the transmission is still not completely understood. So we still should refrain from
Right.
interacting too loosely once vaccinated. Once we get a majority of people vaccinated, then you can go over to whoever's house because they got it too, and their friend got it, so you
Exactly.
can go to their house, and your group of people got it, so you can all hang out. So that's the difference, as opposed to now where it's as I was ramping it up.
Exactly. And of course, you can also there's also the possibility that if you're vaccinated, but most people aren't, there is a possibility uh, of viruses being on you, not necessarily infecting you, and you could maybe
Yeah,
give that to somebody else through close
yeah, they can
contact.
still get it from the surfaces and things like that, right?
Right.
So it's still out there. But the take home message is, don't let any history of allergies dissuade. I would get it. Don't think that whatever's in there is some kind of weird chemical that's going to give you, lupus in 20 years. Don't think about that. Just get it, because it's not the virus that you're getting. It's
No.
a it's a
Yeah.
we talked about this before. It's a memo to help print proteins that the body recognizes as the virus, and then you get antibodies to that, and it's great.
Exactly. This is a new vaccine, a new way for a vaccine to work.
Yeah,
Now, that's right, because the vaccine uses RNA, messenger RNA.
yeah.
Uh, it uses basically less of the virus than previous vaccines
It
have.
uses this much of it. This little,
Yeah,
it's this core of the whole ball of wax. It's this little strip of information that produces the proteins, and the body says, "Oh, this protein is bad," but the protein isn't doing anything to you because it's not the virus. It's just the protein. But it says, "Hey, that protein is bad. Let's antibody against it," and as a result, you got antibodies against the virus, because once the virus enters your body, those are the proteins that the body recognizes, and the antibodies attack it, and the virus is destroyed.
exactly. And I think it's important to reiterate that the that yes, as with basically all medical treatments, vaccines will have some kind of side effects in a very tiny amount of the population. However, diseases can have side effects among a much larger amount of the population, and those side effects can often be lifetime damaging. I mean, remember polio. Polio
Yeah,
was a disease that would paralyze people and children frequently, but then we developed vaccines for it, and now we don't have to worry about polio anymore.
yeah.
Whatever side effects that the polio vaccine had were minimal compared to the side effects of the polio disease.
Right, and the same thing to now. The side effects of the vaccine are minimal compared to getting the disease, or the inconvenience you have to go through if you get it by being isolated for 10, 14 days. And then who knows? I mean, most people are recovering, but I've seen a couple of patients who are just a little fatigued every day now more than they used to be, or
Right,
uh, just they don't have their not only their stamina but their wind back. They can't do they're taking out the garbage, short of breath. They got to pause for a minute after they're done with that. So, and who knows what's going to happen down the road. It could be it's a pre-existing condition when you're applying for new health insurance. I mean, it's a lot of weird stuff that
right.
you can get the vaccine and avoid it. You do.
Exactly. It's a new weird virus. We don't completely understand it. So if we can just prevent all of the unknown from happening, then we don't have to worry about it, at
Yeah,
least for the people who get a vaccine. Now, we do
100%.
have a interesting question from the chat about why does some get Bell palsy from the shot? I know it's few and far between, but it makes us wonder. Yeah, what is Bell palsy?
Bell's palsy is a infection or a viral infection of the trigeminal cranial nerve in the head,
Oh,
um, which, if a virus or if it gets infected, that's what Bell. It's an infection or a viral attack on the uh, trigeminal nerve, and it causes a funny facial droop. I'll show you what it does. No laughing, but it kind of does something like this. It's like,
oh no.
and you walk around like this, and you're looking like this for a while, and then things get better, and it resumes to normal, but it
Okay.
may not get back to fully normal, and you have a little numbness perhaps, and of course this or the other side, whichever side of it, and you just it's just a funny looking weird thing, and it could be a little uncomfortable on the skin too. And then
Right.
as it slowly reverses, so I don't know about that as a part of the side effects of this vaccine or any vaccine.
Right.
And Bell's palsy is anybody. I mean, you don't have to have a vaccine to get it. It's just an attack
Right.
on the trigeminal nerve. It's a known medical situation.
And if it's caused by can it be caused by the COVID-19 virus? Do we know that?
About on the virus, I don't know. I don't know. I haven't seen data that showed higher incidence of it in most patients, so I
Okay.
don't know. But it's it can occur in anybody. It's a little. It's not rare. It's uncommon, but it's not like write a journal article on it. It's a known infection, let's say, but it doesn't. It doesn't. It can be completely reversible, but then again, sometimes not.
Right. Now, I think
No.
now would be a nice time to wind down and re-emphasize very important points about this vaccine, about this disease, about what it means for there to be such a large volume of people that are sick. Were there any other topics that you really wanted to bring up
I just
for
want to
today?
encourage people to get the vaccine to bend the curve, so the
Right.
hospitals aren't, overwhelmed in the future. So we can do the things we like to do without, you know, restriction, and to just become a kind of normal again. But the vaccine is our way of doing it, because right now we have sort of demonstrated that social distancing and staying home is not the best. It's not working that well for us. I mean,
Yeah.
we got half the folks who are all in on that technique, and the other half are saying, "Hell with it, I'm going out," and that's the problem.
Right. There's just not enough preventive behavior happening. I
The
mean,
vaccine's our way out of this. That's the only, and everyone's got to do it.
340,000 people in America, just this country,
One out of
have died.
1,000.
1 out of 1,000. 0.1%. That might sound tiny, but it's just not. With large numbers, that is a very large volume. And
Yeah,
most of those were
1% of
preventable.
people, about what, 2.5% of cases,
Right.
something like that.
This is why doctors have always been telling us that we need to be wearing masks, we need to be staying away from each other, and we need to limit large gatherings, because this disease kills people. This disease not only just kills people, like, I don't know, instantaneous guns do, but it also makes people fight for their lives and then die in a hospital room using a ventilator. Or what's happening now is that some people aren't able to get ventilators because there's just too many people that need them. This
Right.
is the culmination of this is the culmination of what happens when you don't try to prevent the spread of a disease. And so now we're asking that everybody forgets what has happened before and just learn from it and do what needs to be done now and in the future, which is get the vaccine. Make everything stop.
Be active and try to find it. Don't let it come to you. Go out and find it, and you'll get it.
Exactly. You need to protect yourself, protect those around you, and protect those that are even far from you because of how complicated spreading webs can be.
Right.
All right. Well,
Good message.
I think,
Good ending message.
yes, that's a nice place to end off the show for today. If you have any questions or concerns, you can email us at myworldsciencetv@gmail.com. And if you happen to want to see Dr. Sherman, he is vaccinated, and he does gastrointestinal stuff. His office email and number are going to be in the chat. And until next week, stay safe, plan to get the vaccine, and until then, wear masks, don't see your friends,
Yeah.
and prevent the amount of suffering that's going on in another place that you don't currently see. All right. See you next week.
Thank you.